Hello, I'm Dr. Marla Shapiro, and I'm a past president of the Menopause Society. And today we're going to be talking about a concept called cognitive behavioral therapy. You may have heard it abbreviated by the letters CBT. And to have this conversation with us is Dr. Sheryl Green. She's an associate professor and co-director of clinical training in the Department of Psychiatry and Behavioral Neurosciences at McMaster University, clinical and health psychologist, Women's Health Concerns Clinic, and the Firestone Sleep Medicine Clinic in Canada, a fellow Canadian like I am. CBT is something that women have heard about, but don't necessarily know what it is. So first, a broad definition of what CBT is, and then specifically the role it can play in managing midlife women's menopausal symptoms.
Certainly. So, yes, that acronym CBT. A lot of people have heard about it, but not necessarily know what it is. Cognitive behavioral therapy is what it stands for. It's an evidence-based psychological and behavioral treatment, which just means it's been shown by research to be very, very effective for over 4 decades here now. So it has quite a positive history. It involves talk therapy that's delivered by a trained healthcare practitioner. And what we're trying to accomplish here is identifying inaccurate beliefs or negative ways of thinking about a situation or a symptom, and providing folks going through the menopausal transition with different tools and skills and strategies to help them with those symptoms and situations that they're experiencing and having a difficult time with.
So
Um,
let's talk about the type of menopausal symptoms that CBT would be, um, a good trial for. What, because when you think about hot flashes and night sweats, you think of them as being a physical symptom.
Absolutely. So CBT was originally developed to treat anxiety and mood disorders like major depressive disorders. So it has expanded in in what it's helpful for in the last 4 decades, including menopausal symptoms here now. And some of the top 5 symptoms here of menopause, as you mentioned, vasomotor symptoms are
Mhm.
also known as hot flashes, night sweats, along with anxiety, depression, sleep difficulties, like insomnia, and sexual concerns.
Right.
And in the general population, CBT is considered the first line treatment for depression, anxiety, and sleep disorders.
Mhm.
And more recently here now, it has been shown to be a very, very effective treatment for hot flashes and night sweats. But it's not necessarily so intuitive as to how we would use a psychological behavioral
Right.
treatment to target this physical symptom. So really, really important to consider the goals associated with treatment for the hot flash. We're not necessarily trying to get rid of the hot flash completely, just like if we were treating someone with chronic pain, we're not ready and thinking about trying to get rid of the pain completely. It's unrealistic. So what we're trying to do instead is target a lot of different aspects of the experience of the hot flash, like how severe it becomes, how distressing it is, how much it interferes with a woman's life, and how long it hangs around for, how frequently it comes about. So those are the areas that we target in an effective way using cognitive and behavioral strategies.
So if I'm using a medication of some sort for management as a patient, regardless of what it might be, is there still a role for CBT?
Absolutely. That's probably the most common category of menopausal patients that I see, that they're already taking a medication and they're finding some type of relief with it, but not a full type of relief. And it's still distressing. It's still, those symptoms are still distressing and interfering with daily life. So what CBT offers is a very nice complementary form of treatment. So we're taking the medication, but also learning different skills and tools and strategies to reduce that distress, reduce the interference of the symptoms, and yeah, really manage it in a more effective way.
So if I am looking for help with CBT, how
Mhm.
do I begin to do this on my own if my own practitioner doesn't really have someone to refer me to? There is so much
Mhm.
exploding online and books that are out there. Can you
Mhm.
help direct?
Certainly. So I think the good news is cognitive behavioral therapy is one of the most popular, if you will, and understandably so with how effective it is for folks who are trained in psychological treatment. So there are a number of practitioners out there trained in CBT. And if your family doctor or gynecologist doesn't have any recommendations, one can certainly go online and to look at some of the national associations that exist, like the Association for Behavioral and Cognitive Therapies, or in Canada, the Canadian Association for Cognitive Behavioral Therapy, and find a clinician or a therapist online there. And as you mentioned, there are so many different self-help books out these days, and so nothing stopping someone from going online and finding a cognitive behavioral therapy self-help book. There's even
Mhm.
ones that are specific to vasomotor symptoms and
Right.
menopausal symptoms out there, and kind of getting a little bit a better understanding and starting to maybe utilize some of those strategies from the book right away.
Well, thanks so much for making us aware
Mhm.
that there are strategies that we can use either with medication or without medication that really can help us cope with our symptoms, cope with our response to our symptoms and our attitudes and belief that we may not even know we have ingrained within our approach to menopause.
My pleasure.
Bye for now.